Look, vaping means sacrificing your health to people whose sole interest is to make money off of your addiction. Most e-cigarettes and vapes are highly addictive, but they're being marketed to you by people who do advertising for a living, and they're experts at getting you to use, to maybe break down your willpower to start using and keep using. They don't care about you or your health. All they care about is money. At the end of the day, making money for the people that they work for, and that involves, again, sacrificing your health and getting you addicted so they can make money.
Most vapes contain nicotine, which is highly addictive. Nicotine can harm the parts of an adolescent's brain that control attention, learning, mood, and impulse control.
One nicotine vape has the same amount of nicotine as 1 to 2 packs of cigarettes, roughly 20 to 40 total cigarettes.
Starting in 2020, we've seen an outbreak of lung injuries and deaths associated with vaping, E-Valley, or e-cigarette or vaping use associated lung injury. In February of 2020, the Centers for Disease Control and Prevention confirmed 2,807 cases of E-Valley and 68 deaths attributed to that condition. The CDC has identified vitamin E acetate as a chemical of concern among people with E-Valley. Vitamin E acetate is a thinning agent often used in THC vaping products, and it was found in all lung fluid samples of E-Valley patients examined by the CDC.
Nearly 1/3 of deaths from heart disease are the result of smoking and secondhand smoke.
2 milligrams of fentanyl equates to a potentially deadly dose. In 2023, the DEA seized more than 80 million fentanyl-laced fake pills and 12,000 pounds of fentanyl powder. These seizures are equivalent to more than 390 million lethal doses of fentanyl.
Naloxone, Narcan, is a medicine that rapidly reverses an opioid overdose. It is an antagonist. This means that it attaches to opioid receptors and reverses and blocks the effects of other opioids. Naloxone can quickly restore normal breathing to a person if their breathing has slowed or stopped because of an opioid overdose.
Alcohol is among the most commonly misused addictive substances. About 12.7% of American adults meet the criteria for alcohol use disorder. That's 1 in 8 adults.
About 178,000 people die from excessive drinking each year. These deaths occur from both drinking alcohol over several years or drinking too much.
Alcohol is a depressant that slows down the activity of the central nervous system. This can lead to impaired judgment, slurred speech, lack of coordination, lack of concentration, and drowsiness.
Roughly 28 to 30 people lose their lives every day in an accident involving drunk driving.
If you or someone you know experiences a substance use or mental health crisis, you can reach a trained crisis counselor who can help find treatment by calling or texting 988, calling 1-800-662-HELP, or visiting www.findingtreatment.gov. You can also call, text, or chat with the Massachusetts Behavioral Health Helpline for a real-time clinical assessment, 24 hours a day, 365 days a year, at 833-773-2445.